to another episode of the Tee List. I have my amazing guest, Felicia. Felicia, can you please introduce yourself to our guests today, our viewers today?
Sure. First, thank you so much for having me. Very excited to do this. This is my first time being on a podcast. So I'm very, I'm honored that you even asked me to do it. So my name is Felicia Washington Brown. I am a certified nurse midwife. Been a certified nurse midwife now for about 6 years. I was a labor and delivery nurse before that for maybe about 12, 13 years. I always knew I wanted to go into women's health care. Wanted to be a doctor first and had a family, had a bunch of children, and decided that's not going to work. And then I went to this route, which is very much a much better route. So yeah, that's like a little bit of me in a nutshell.
Okay. So what are some of the most significant disparities Black women face in maternal health care?
There's a lot. So I'm sure you and all of your viewers know, a lot of us felt like we are not being heard. A lot of us have inadequate care, whether it's because we live in healthcare deserts, meaning like if, let's say, we're in a rural area, Midwest, we have to travel miles with no transportation to get to some place to be seen. There's systemic racism that's built within medicine, and that puts us at a disadvantage because a lot of the testing and a lot of the way Black people in general are looked at kind of throws it off as, oh, you can tolerate pain, or you can tolerate this, or you can do these things. So we are less likely to be diagnosed with certain things. We are less likely for our pain or our problems to be taken seriously. We have high rates of uninsured, right? A lot of us have medical insurance because we work. I have medical insurance because we work. We can't afford to not work and not have it and try to pay it because it's crazy. Okay. And most of us have life-threatening conditions. If we even look at women, right? We talk about preeclampsia, we talk about high blood pressure, we talk about diabetes. And is it because of the neighborhoods that we lived in or subject to live in, and then what's provided in those neighborhoods that kind of prompt us to have these severe medical conditions that we're not treating or not able to get treated? The limited access to prenatal care, to even just regular GYN and health care. As women, we feel something is off, we want to go check and see somebody, and that's limited too. And just the history of the overall trust in medicine, it's a little off too. So these are all of the disparities and all of the issues that we face.
Yeah, we face a lot of struggles.
Yes.
So what are changes do you think are necessary to address these disparities?
These are good questions. So first we have to recognize these disparities. And we have to also recognize within ourselves that we have to become more knowledgeable about ourselves and more knowledgeable to advocate for ourselves, right? The internet is out there. We say Dr. Google, let's say Cousin YouTube, Nurse TikTok. We have all of them, right? But the problem is that they give us all of the information, right? But not everything applies to us. I never tell someone, don't go searching, but don't have anxiety and become overwhelmed. Take that information, go to someone. If you come to me and say, hey, I Dr. Googled all this stuff, Miss Felicia, does all this apply to me? Right? And I'm going to say, no, all of this doesn't apply to you, and put your mind at ease, right? Because knowledge is power only if it's applied. So we have to apply the knowledge that we have to reap the benefits of it. The more we read, the more we look up certain things, the same thing that's available to the regular person that's at home is the same information that's available to me as a healthcare provider. And we have to recognize that the systemic issues, and we have to advocate for ourselves. And if we feel that one doctor is not doing it, then we need to find another. And if we feel like this doctor is not hearing me, then you know what? Thank you and I appreciate your time, but I'm going to go look for someone else. Don't just settle for that one person. I think most of us like to settle a lot for what's convenient. Everything is what's easy, but we have to kind of really, really go out there and find someone whose views align with yours, who's someone who's willing to help you, and someone who's willing to think outside of the box. Because just because the pharmaceutical companies say, hey, this is the pill to do it, but maybe that pill doesn't work for me and I need something else, and they need to be willing to give me that something else, that so-called alternative medicine, give me that other option, so to speak. We have to also understand certain tests. It's funny because you made me do a lot of reading, being that you're gonna you're gonna ask me a bunch of questions, and I was like, oh my god. So what I realized is there's one test that we take during prenatal care when we're pregnant called AFP, so it's alpha fetoprotein.
Yeah.
That test is to look at like genetic abnormalities that our child might have, right? What's so funny is the calculation and the percentages of that test is changed, I want to say yearly, but only for Black women.
Why?
This is our systemic issues that's happening. So as they change it and they up the percentage, right, we are now less likely to be diagnosed with a trisomy or diagnosed with a genetic abnormality. And then we might have a child that comes out with this problem, but yet we take the test and it's like, oh, it's just a screening. Right? I recently just found out that the pulse oximeter, you know, that little thing we put on our finger that takes our oxygen saturation and heart rate, it doesn't work on darker skin. It's programmed not to work as well on darker skin. And though all of this research has been done and these studies have shown that it doesn't work, the calibration hasn't changed. So if you come in with asthma and you're a darker complexion than mine, and you might be satting at a 97, but you're really satting at like a 94, then you'll be like, oh, she's good. Why's she coming here complaining? Right? Like, I'm just saying, like, these are the systemic issues. Same thing with us in kidney disease. We are less likely to have a kidney transplant because the test is skewed. The women who want vaginal deliveries after C-sections, they used to have this VBAC calculator that would lower it by 15% if you're Black or Hispanic. So we as a people have to understand that these things are within medicine that's been way before my time and our parents' time. Yeah. So once we recognize these things, we can advocate for ourselves and find those providers that also know these things and are also willing to advocate for us. So that there's a lot out there, and listen, give thanks to all of the TikTok and all this, because people all over the world are like, look, I'm in the National Library of Congress and look what I'm finding. And it's great that this knowledge is being put out there, and more of us just need to know about it. And I think that will help move forward the way we look at ourselves and how we manage our own health.
Yeah, we have to do the homework.
Yeah, 100%.
And not let these providers gaslight us by telling us, oh, we're young, the pain should go away. Like, we have to. Pain
is not normal.
Yeah, it's not.
Pain is our body telling us something is wrong. Like, just it's just age. No, girl. Like, there's a 90-year-old who's kicking ass and taking names, and we need to understand that that's a way that our body is talking to us, right? So we just have to do the best we can with what we got.
How can Black women advocate for themselves in medical settings where they feel unheard or dismissed?
So a lot of the same things I said. Obviously, be informed, know your body, find a provider, with ideals that align with yours. Communicate with your family, because, as original people, we are family centered. And what I might not know, maybe my sister knows, maybe my mother knows, grandma, auntie, uncle, they've been through life way long before me. So communicating with family, getting their support, bringing somebody with you. If you're not confident in yourself to tell the doctor no, get somebody who can, who understands and agrees with your views to kind of help you and speak up for you. And have basically just knowing about your body, knowing what your body wants and what you want for yourself overall. I think the most thing is that people don't know. People don't check themselves. They don't know what their parts look like. They just think, this make me feel good and this doesn't. And it's way more than that. It's that longevity of health. It's that longevity of feeling good. It's not just that quick fix that, what Americans really are looking for and what, the world looks for the, the most part. And I think knowing what you're willing to accept and what you're not willing to accept, knowing what you need versus what you want, because needs and wants are two very different things, then you can be able to discuss that with someone and say, I don't think that's going to work for me. This is my lifestyle and this is what I'm able to get to, and this is what I can afford, so how can we make this work? How can you meet me in the middle? and make it work. So we just, like you said before, you said it perfectly. We got to do the work for ourselves so that way we can meet the other person halfway.
Yeah. So what role do midwives play in bridging the gap for Black women in healthcare?
Well, historically, medicine came out of midwifery. So historically, midwives were the one in the home taking care of the whole family. It wasn't just us delivering babies. And I think people think of a midwife as, oh, I'm not pregnant.
Yeah.
I get that all the time. Oh, I'm not pregnant. And I'm like, no, I take care of all of you, like regardless whether you're pregnant or not, right? So because we were there taking care of the whole family, and also keeping that family together. So I'm your healthcare provider, I'm your social worker, I'm your psychiatrist, I'm your best friend if I need to be, right? I'm your advocate, I'm your voice when you don't have that voice. Our visits are not those 15 minutes like, okay, boop, 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 all right, you're good, girl. I'll see you in another year, right? We take the time to get to know you as a person and what you want for yourself, and to try to encourage you to be, to know yourself better, and to also advocate for yourself. Because if you come to me and I'm asking you, you're telling me you don't know, I'm like, well, you need to know. I can't tell you what to do for your own body because you live in that body, right? And it's interesting because out of all the United States, there's only 7% midwives that are Black. So that's something that's interesting when it started with us, right? But we help to keep families together. We help keep it family centered. We help to keep people informed, and we help to just keep this generation going, right? And keep this natural, holistic sense of what health is going. Because I can tell you the medical way, but I can give you a natural way that probably will work even better. Right, and then maybe a little less expensive, right, if you kind of stick to it. So midwifery is all around the world. We provide compassion, education, like everything you can think of that somebody might need, not want, but maybe what they need, is what definitely midwives provide.
Okay, I'm going to give you a statistic.
Okay.
So up to 80% of women will develop fibroids by the age of 50. They are most common in women of reproductive age and are particularly prevalent among Black women, who are 2 to 3 times more likely to develop fibroids compared to women of other races. So, Felicia, why are Black women disproportionately affected by fibroids compared to other groups?
So first we have to look at what fibroids is, right? So non-cancerous tumors that grow on our uterus, right? And again, this is the education piece, right? Because I need people to understand what it is and why we are the ones that's getting it, right? So non-cancerous tumors that grow on the uterus. And then they say, well, how am I getting non-cancerous tumors on the uterus, right? So we have to look at now what we're putting in our body and what we're putting on our body, right? Because the skin is our biggest organ, right? We have pores all over, and whatever we put on it also seeps in and also affects us. So then that makes us look at what neighborhoods we live in, what foods are provided, what cosmetics we use, what lotions, what gels, what soaps, what perfumes we use that now might be affecting what's happening to us inside, right? So if we have these non-cancerous tumors that are hormonal based, right? They feed off of estrogen, and estrogen lives in our fat. So the more fat we have, the higher our estrogen is, right? So I always ask people, so if estrogen is this food, so where are we getting all these hormones from? The foods that we're eating. Just basic, right?
Yeah.
The foods that we're eating. So the chicken, the meat, everything we know that's being juiced up so that way it's more pumpy, it's more full to provide for the population, right? Now, are these foods that we're eating, whether they're chicken or vegetables or not, what is the quality? Are they healthy? You go into a community of color, how many vegetable stands do you see versus fast food stores? Right? Like McDonald's, excuse me, Kennedy Fried Chicken.
They're all over.
Right? No, they're all over. So, and they're cheaper than going to the supermarket to say, hey, you go to the supermarket, you spend $20 and or $100 and literally get one bag of food versus maybe $10 and you can go get a hamburger and fries and a drink.
Yeah.
Right? So we have to look at the foods that are available to us, the communities that we are allowed to be in, and I choose my words specifically, because if we go to an outside community and we live in another community where it's not predominantly us, we more than likely have more problems than not, right? And then that's where you find your better sources of food, your even better sources of vegetables, right? So I'm plant-based, but I don't shop in my community. I go outside of my community to go shop because I know the vegetables there are better. Right?
Yeah.
Does that make sense? I mean, I have to. It doesn't, but I have to do the best for me and my children, right? And which is why I tell everybody, hey, if you have that ability to have that transportation, then you need to go outside and you need to find something better. But hey, liquor store, Chinese store, corner store, pharmacy, liquor store, Chinese store, like you go every block and you see it's the same. It's the same MO. So you're getting yourself drunk and killing your liver. You're eating the wrong food, but then you don't go to the doctor. So here's the pharmacy because they're gonna give you meds to just put that Band-Aid over the gaping wound. Right? So if we're feeding these fibroids, and now these fibroids are growing, and what do these fibroids cause? Problems with our menstruation, problems with our fertility, problems with us getting pregnant, problems everywhere. Even just having sex, some people have problems and pain. Right? Hormone regulation, hair falling out, hair thinning, can't lose weight in the right places. Right? Like some people like it thick in the thighs, but they don't want it thick in the arms, right? I mean, listen, I'm making jokes, but
yeah.
we as women, we go through it and we kind of know what it is. So even if you look at a map of the world, fibroids is now affecting even. Let's take the continent of Akibulan. So that's Africa. So Africa was called Akibulan before it was called Africa, right? There's fibroids mid-Africa and south. There's barely none North Africa. And North Africa is where the Caucasian population is. Why? Because they're given predominantly the best things while the rest of the population has to struggle to try to get the best things. And it's the same thing all around the world. So we also have to stop pointing the finger and looking at other people and taking note for ourselves that why am I waiting for somebody else to try to do things? Let me try to do better in my own community. So even for me, I just try to do better by informing and telling people, hey, this is what it is and you need to do better in this type of way, or try to find a way to do better. But these are the things that affect us as Black women, is what we're able to get our hands on and what we're able to do and the knowledge that we're able to have. Everybody's going to tell you, oh, you got fibroids, take birth control. Birth control, you got estrogen. So it's not helping you. It's just giving you more and regulating your menstrual period, because that's how it's going to show that you have a problem.
Yep, my cousin, this is for my cousin today, because I told her, but I wanted you to see it. Like, I had fibroids, well, 5 of them. And the doctor was ready to do surgery. He's like, it's time to remove them. I was on birth control, and I was bleeding for like a whole month and a half. Pain, tired. I was just, felt terrible. And it was heavy bleeding. Then I got on the phone with you, and we were like, fibroids are hormone-based. You're taking birth control. Stop it. I stopped it. I changed my diet. Now I only have one still today that's less than a centimeter. So yeah, girl, get off that birth control.
Listen, if you don't need it, if you're not sexually active, then there's no reason. There's no reason for you to be taking it. If we look at the signs and symptoms of fibroids, because people are like, oh my God, how do I know I have it? We can grow them and we can shrink them and we won't even know. You might have a heavy period and that could be the fibroid, what we call disintegrating or shrinking. And you won't have symptoms until that fibroid usually grows 3-4 centimeters and it starts to affect your periods, right? And fibroids can go anywhere. It could be on the uterus, it could be inside the uterus, it could be what we call pedunculated, so it's like a little mushroom hanging out like, hey, I'm over here, right? But they all affect the space that we have within our uterus, because our uterus is a muscle that's very, very vascular, so it has a lot of blood flow, so it's just feeding. The first symptom that we usually see is issues with our periods. So our periods become heavier, periods become longer, and we start bleeding in between our periods. That's the first problem that we see. And then we run, and then the solution is birth control. well, medicine solution is birth control. If I get a nice girl that's plumpy, right? She's not overweight, she's just plumpy. I tell her, girl, lose 5 or 10 pounds and I guarantee you your period will go back to normal. Like I said, it changes our periods. Then if we have 5, like how you had 5, and we have some that are a whole bunch of different sizes, the moment they're 4 to 5 centimeters, it's like, oh, let's take them out. Surgery is not even a quick fix, because it's, and this is going to sound funny, but it is what it is. So they go in, and it's almost like, you know, like those round ice cream scoopers? Like, they take out the fibroid, and that's what your uterus looks like. It looks like an empty,
oh wow,
it looks like an empty hole, right? But the problem is, you didn't get to the root of the problem. So it's like, I just take away the fibroid, but you didn't stop or prevent the reason why it grew. So they're still going to grow, and more is going to continue growing, even though I went in and scooped them all out, right? And then what women don't know is that you see all these videos, oh, Fibroid USA or Fibroid,
yes, it was on the radio today.
Whatever, right? It's, at one point I was hearing it like nonstop, and all of these women were going and getting it done, and then they realize they get pregnant, and now you need a C-section. Any surgical procedure that happens on your uterus, that your uterus is cut into, or it has affected your uterus surgically, that they have removed tissue, you cannot deliver vaginally. Because now it's unsafe for your life and that baby's life. That uterus is a muscle that needs to contract. And if some of that muscle is not there, what's going to happen is you're risking of a uterine rupture, which means what? Your uterus can basically explode open, and now you're bleeding out and the baby is swimming in blood. The root of the problem is your lack of exercise. The root of the problem is what you're putting in your body. And then if we talk about what we're putting on your body, there's a lot of toxicologists coming out now talking about all of the endocrine disruptors and the PFAS things that are in our lotions, our soaps, the perfumes, the aerosol deodorants, and all of these things are affecting us in our estrogen. So we as women carry all the eggs that we will ever have in our life.